You probably think doctors have always washed their hands before touching a patient. They haven't. In 1847, one doctor proved that hand washing could cut death rates by 90%. The medical establishment's response? They fired him. They mocked him. They called him insane. And then they locked him in an asylum, where guards beat him, where they put him in a straitjacket. 2 weeks later, he was dead. From an infected wound. The same type of infection he'd spent his entire life trying to prevent. Vienna, 1846. The largest hospital in the world. Inside, 2 obstetrical clinics. Same hospital, same patients, same disease, but wildly different death rates. The first clinic was staffed by doctors and medical students. Their mortality rate? 10%. Sometimes 18%. Nearly 1 in 5 women who walked through those doors died of childbed fever. The second clinic? Staffed by midwives. Their death rate? Under 4%. And here's what haunts me. The women knew. They begged on their knees not to be admitted to the first clinic. Some women deliberately gave birth in the street, because the mortality rate for street births was lower than the doctor's ward. Think about that. Giving birth on a cold Vienna sidewalk was safer than being examined by a doctor. Your admission day was decided by the calendar. Monday, first clinic. Tuesday, second clinic. Your life and your baby's depended on which day of the week you arrived. Nobody understood why. But here's the part that makes your skin crawl. There's one detail that changes everything. And a young Hungarian doctor was about to find it. His name was Ignaz Semmelweis, 28 years old. Born in Budapest to a German-speaking grocer who ran a spice shop called the White Elephant. He'd studied law first, then switched to medicine. In 1846, he was appointed assistant at the first clinic, the one where women died. He was obsessed with one question. Why his clinic? What was different? Then in early 1847, his close friend Jakob Kolečka died. Kolečka was performing an autopsy when a student accidentally cut him with a scalpel. Within days, Kolečka was dead. Same symptoms, same pathology as the women dying in the first clinic. Semmelweis froze. The autopsy report read exactly like the deaths he'd been tracking for months. And suddenly, he saw it. The doctors in the first clinic performed autopsies in the morning. Then they walked straight to the maternity ward. Same hands. No washing. They carried what Semmelweis called cadaverous particles, invisible material from dead bodies, directly into living women. The midwives in the second clinic, they never touched corpses. That was the difference. The doctors were the killers, and they had no idea. May 1847. Semmelweis ordered every doctor and student to scrub their hands with chlorinated lime solution before examining patients. He chose chlorinated lime for a simple reason. It was the only thing that removed the smell of death from their hands. He didn't know about bacteria. Germ theory wouldn't exist for another 20 years. He just knew the smell was a clue. The results were immediate. April 1847, before the protocol. Mortality, 18.3%, June 1847, 2.2%, July, 1.2%. By the following year, some months recorded 0 deaths, from 18% to 0, by telling doctors to wash their hands. If you're subscribed to ScienceLore, you know how rare it is for a single intervention to have this kind of impact. If you're not, subscribe, because what happens next will make you furious. You'd think the medical world would celebrate. Thousands of lives saved. Clear data. Simple solution. They rejected him. Not quietly, actively. Johann Klein, Semmelweis's own superior, refused to support the findings. He was Austrian. Semmelweis was Hungarian. In the political tensions of 1848, that mattered more than data. Rudolf Virchow, the most powerful man in European medicine, dismissed the theory entirely. His authority alone was enough to bury it, and across the Atlantic, Charles Meigs of Philadelphia was so offended by the suggestion that a gentleman's hands could carry disease that he considered it an insult. A gentleman's hands, he believed, were inherently clean. In 1849, the hospital did not renew Semmelweis's contract. He left Vienna without saying goodbye to anyone. His successor, Karl Braun, publicly listed 30 causes of childbed fever. Cadaverous infection was number 28. But here's the irony. Braun secretly continued the chlorine washings. He knew Semmelweis was right. He just couldn't say it. Semmelweis moved to Budapest. He achieved incredible results. Mortality under 1% at St. Roku's Hospital. But recognition never came. In 1861, he published his masterwork, The Etiology, Concept, and Prophylaxis of Childbed Fever. It should have been his vindication. It was a disaster. The book was rambling, repetitive, poorly organized. One critic called it the Koran of puerperal theology, and then Semmelweis snapped. He wrote open letters to every major obstétric in Rejection in Europe. Not polite disagreements, accusations. He called his colleagues murderers, efficient murderers. He called Friedrich Scanzoni a medical Nero. He wrote, "Most medical lecture halls continue to resound with lectures against my theories. My teachings are either ignored or attacked." By 1865, his behavior alarmed everyone around him. Excessive drinking, time away from his family. His wife noticed changes she couldn't explain. The brilliant doctor who had saved thousands was coming apart. July 30th, 1865, Ferdinand von Hebra, once Semmelweis's supporter, invited him to visit a new medical institute. It was a lie. When the carriage stopped at the gates of the Landesirrenanstalt Deuteling, Semmelweis understood immediately. He tried to leave. Guards seized him. They beat him. They forced him into a straitjacket. They locked him in a darkened cell. They doused him with cold water. They gave him laxatives. This was psychiatric treatment. In 18065, 2 weeks later, August 13th, 1865, Ignaz Semmelweis was dead at 47. The cause? Pneumonia. Blood poisoning from an infected wound on his right hand. The man who discovered that infections spread through contaminated hands died of an infection on his hand in an asylum. Beaten by guards, almost no one came to his funeral. 20 years after his death, Louis Pasteur published his work on germ theory. Suddenly, everything Semmelweis had observed made scientific sense. Joseph Lister pioneered antiseptic surgery. Hand hygiene became standard practice. Semmelweis was right all along. But here's what stays with me. After Semmelweis left Budapest, his successor immediately stopped requiring hand washing. The mortality rate rose 6-fold. 6 times more women died. And nobody protested. Today there's a term in psychology called the Semmelweis reflex. It describes our tendency to reject new evidence when it contradicts what we already believe. We named a cognitive bias after him. That's his legacy. But I wonder, how many Semmelweis moments are happening now? How many times are we... Semmelweis saved lives with a simple truth that the world refused to hear. But what happens when the truth is more complicated? when the same person saves millions and kills millions? In 109 a German chemist solved a problem that had haunted civilization for centuries. He pulled nitrogen from thin air. Today, half the people on Earth are alive because of his invention, but there's a photograph from 1915. The same chemist stands on a Belgian battlefield, watching soldiers choke on a yellow-green cloud. The gas was his creation, too. That night, his wife found his military pistol. By morning, she was dead. His name was Fritz Haber. Title suggestions, 5 options. The doctor they locked away for saying wash your hands, 55 chars. 2. He saved thousands. They put him in a straitjacket, 52 chars. 3. 18% of women died here. One doctor knew why. 46 chars. 4. The doctor who died of the disease he cured, 44 chars. 5. Wash your hands, the man who paid with his life, 49 chars.